We have a plethora of questions here, so I'm going to read them out loud, and we will have one of the presenters respond. I apologize, there are a lot of questions. We are not going to be able to get on to all of them. One of the participants asked, is there any data on bullying for children in grades K through 8? Dr. Espelash, do you want to respond to that?
Yes. Yes, as a matter of fact, Laura Hainish, H-A-N-I-S-H, and her group at Arizona State have done a series of studies with preschool playgroups and have found a remarkable high incidence of not just kind of normative physical aggression, but exclusion, social aggression, and so, you know, it used to be that we felt pretty good about kids having a good experience in early childhood and early elementary school years, but and then we would be concerned about bullying involvement in the 5th grade. It appears that it's emerging early in those studies, earlier.
Okay, great. There was a question about how efforts are coordinated or complemented with the Department of Education. I can say that the CDC and actually more broadly Health and Human Services works very collaboratively with the Department of Education. We have representatives who work together on the stopbullying.gov website, and there's also a Federal Partners on Bullying Prevention Task Force, which convenes an annual meeting that just happened this past August, but we work very collaboratively together. Okay. Let's see. We have another question here about if there are efforts being made to deter bullying outside of the school, or if there is a carryover effort to deter bullying in school to outside of the school. So I know the ADL and GLSEN work somewhat about bullying both in and outside of school, so I don't know if both David and Dr. Espelash want to weigh in on that one.
I would, I'm actually very encouraged about the efforts that are going on outside of school. I think for the longest time we've pointed to the schools to solve this problem, not recognizing that youth interact in different contexts. So in the last year with the raising of the public awareness of bullying, I've been contacted by coaches, American Coaches Association, to do some training around bullying prevention and how they might be contributing. In addition to that, faith-based organizations, Girl Scouts, Boy Scouts, and so much like the Canadian model, there's PrevNet in Canada, and they involve everyone, right? We also have the Cartoon Network on board. We have Facebook, and so I would say yes. I think we're looking beyond the school. But David, you might want to add.
Great, thank you, David.
I would certainly. Oh, sorry.
Go ahead.
I certainly agree with that. Dr. Espelash, I think you and I have been to a lot of the same conferences, so I think we've seen a lot of similar things. But certainly, and with the two organizations that I mentioned, GLSEN and the ADL, those are both community-wide events. And developing this answer to another question, yeah, there certainly are events for libraries and for other places, but the goal for like GLSEN and for, I mean, speaking about LGBT issues, TFLAG and organizations like that, their goal is to get the whole community involved well outside of school, and then also programs like the World of Difference program are designed to have a community effect and take what's going on in the school and build it to the entire community.
Great, thank you. We have a question if there's any information on Native American children, either in general or from other races toward Native Americans. Dr. Espelash, are you aware of any?
No, there's actually a dearth of literature with that population, although there are a number of Native American Indian reservations that are engaged in this type of work, especially as victimization is related to both sexual assault and alcohol and drug use, but there's limited data as far as prevalence and the extent to which they're victims and who their perpetrators are.
Right, and I would add that the Youth Risk Behavior Survey is a representative survey, but it doesn't include schools funded by the Bureau of Indian Education. I know in the past they've kind of combined Native student data across years to find out about the prevalence of specific health risk behaviors, but since the bullying question was just added to the YRBS in 2009, I don't believe they've done any analysis with respect to bullying. But as Dr. Espelage said, I know that Indian Health Service as well as BIE have both been very interested and engaged in our discussions about the issue. Okay. Next question. This question is about funding sources. This person says they've been rolling out a bullying program in schools. Can you recommend possible funding sources to look into? Certainly, the CDC generally funds research-related studies. There's a variety of different private foundations. There's the WT Grant Foundation. There's the Highmark Family Foundation in Pennsylvania. Dr. Espelage or David, are you aware of any funding sources?
Yeah, I mean, I would just add that I think, as funding becomes a challenge, that we have to be creative. And so not only foundations, but also thinking about within your community, if it's a small study, think about corporate sponsorship. So I think we just have to be creative, but certainly what Marci has mentioned, in addition to foundations and corporate sponsorship, is something to pursue.
And I think with funding, yeah, I agree. It does have to be creative when funding kind of is a little bit lower now. What I've seen as the strength, and there are certainly some organizations that are willing to give funding for studies. A lot of them are DC-based and then some are New York-based if you go to the top of a lot of nonprofit organizations. However, a lot of the fundraising that I've done and I've seen has come at the local level, and you've had to do it on, a case-by-case basis where it's literally the old techniques of, hey, let's do a big sale to raise some money for this or something like that, obviously a little bit more developed, but certainly teaching fundraising and having members and people who are involved in the community help you with the fundraising has been a strong point.
Okay, thank you. There's a question that my experience suggests that there is bullying within the immigrant community. However, these parents don't seem aware of it and say it doesn't happen in the old country. How can immigrant parents be engaged in a program to prevent or reduce bullying?
I'll take that one. This is a very, very important question because there's very, very little research conducted on this, right? And so we need to have a handle of, going in there and doing focus groups and interviews with these parents and their students to see exactly what are the barriers, right? Because there's cultural kind of barriers to them, reaching out to kids telling their parents, to lots of different things. I know that there is an increasing emphasis in the National Institutes of Health to fund these types of studies to understand the unique aspects of just the construct itself of victimization and bullying. But on the ground, being in the schools all the time, most certainly there are immigrant populations in our schools that are at great risk for victimization, and who do they turn to, and how are we using culturally sensitive prevention programs? In fact, we might not be, but this is definitely something that the federal government is going to have to fund research in.
Great, thank you. And then we have another one for you, Dr. Espelage. What would be an example of a secondary prevention intervention?
Yeah, so now this is when we think about universal primary positive behavior supports within the school's context would be an example of that, or any kinds of foundations where you're laying the groundwork for behavioral expectations. When that is, implemented to fidelity, then we need more targeted intervention. So even the social-emotional learning second step that I talked about in the steps to respect could be an example of a secondary program if, in fact, the primary program is high in fidelity. Unfortunately, in some of my low-resource schools in inner city, second step is the universal, right? So, but then on top of that, it might be something like CBITS, which is Cognitive Behavioral Intervention for Trauma. It might also include something like Cope Power or the Good Behavior Game or kind of family checkup. There could be a long list. If you go to the SAMHSA National Registry to look at programs within a certain content area, if you're concerned about depression or connecting with families or whatever, like anger or bullying, it'll pull up the programs and it'll describe exactly whether it's primary, secondary, or tertiary. But there's a number of examples out there, but we don't know how it kind of plays in within the context of universal bullying prevention programs.